In our last video, we explored the world of type 2 diabetes, a condition closely linked to lifestyle and insulin resistance. Okay. Today we are discussing a condition that shares a name, same name, okay, but has completely different story. We are talking about type 1 diabetes. Type 1 diabetes. Okay, let me do it. Okay. This is not a lifestyle disease. It cannot be prevented. It is non-preventable, guys. Okay, and it is not caused by eating too much sugars. Type 1 diabetes is an autoimmune condition where the body's own immune system attacks itself. Means it is an autoimmune condition where body's own immune system attacks itself. To revisit our lock and key analogy, in the type 2 diabetes, the locks are rusty. In the type 1 diabetes, the key factory, the pancreas, has been shut down. Means production of insulin is shut down. No insulin production from the beta cells of pancreas. Okay. In this video, we will explain exactly why this happens, how it's diagnosed, and how life-saving insulin therapy works to manage. Okay. So again, what and why, how it happens, why it happens. The core of type 1 diabetes is a case of mistaken identity. It is an autoimmune disease. Okay. Normally your immune system is your protector. Immune system is your protector, creating antibodies to fight off foreign invaders like viruses and bacteria. In type 1 diabetes, the immune system gets confused. It incorrectly identifies the body's own healthy insulin producing cells, the beta cells in the pancreas, as threat. Okay. If it then creates auto antibodies and launches an attack, systematically destroying these cells. Means it is destroying the beta cells of the pancreas, which releases the insulin. As this destruction progresses, the pancreas loses its ability to produce insulin, means no production of insulin. This leads to absolute insulin deficiency and spike of glucose in your blood. There is little to no insulin left in the body. Without insulin, the key glucose cannot move from the bloodstream into the body cells to be used for energy. Okay. As a result, sugar builds up in the blood dangerously to high level, while the body cells are starved fuel causes and triggers. Okay. So why does the immune system turn on itself? The exact cause is still not fully understood, but it's believed to be a two-step process. First is genetic predisposition. Okay, inheritance from genetic. A person is born with certain genes that make them more susceptible to developing the disease. Having a close relative with type 1 diabetes increases the risk, but most new diagnoses occur in people with no family history. Okay. Environmental triggers. In a person with this genetic susceptibility, an environmental factor is enough, okay, to trigger the autoimmune attack. The most suspected triggers are certain viral infection like enteroviruses or the Coxsackie virus. The virus acts like a switch that turns on the misdirect immune response. It's crucial to understand this is not the person's fault. Nothing they did or didn't do cause the disease. Okay, means some viruses like Coxsackie or enteroviruses, they simply make immune system of our body to understand that our own beta cells are the faulty ones. Okay, sorry. Signs and symptoms. Unlike the slow onset of type 2 diabetes, the symptoms of type 1 diabetes often appear suddenly and dramatically, usually over a few days or weeks, especially in children and young adults. Okay, type 1 diabetes mostly occurs in the youngsters and type 2 in the adults. Okay, here also 3 P's are used: polyuria, polydipsia, polyphagia. Frequent urination, intense thirst, extreme hunger. But they are also accompanied by other acute symptoms. Sudden unexplained weight loss. Weight loss is also there in type 2 diabetes, but here sudden weight loss will be there, means within a week you will lose 1 kg. With no insulin, the body can't use glucose for energy. It starts breaking down fat and muscle tissue at a rapid rate for fuel, leading to fast weighting loss. Okay, fatigue and weakness. The body cells are starved for energy. Fruity smell on the breath. Okay, this is a key warning sign of a life-threatening condition called diabetic ketoacidosis. Okay, diabetic ketoacidosis. We will talk it about later. Okay, or DKA, which is often how type 1 diabetes is first discovered. When the body burns fat or fuel, it produces acidic byproducts called ketones. Okay, it produces ketone, and ketones get deposited in our tongue and produce a foul smell. As ketones build up, the blood becomes dangerously acidic, leading to nausea, vomiting, stomach pain, and confusion. DKA is a medical emergency condition. Okay, if DKA condition arises, means there will be severe damages to your organs, major organs. Now we will talk about the diagnosis and monitoring. Because the symptoms are so severe, diagnosis is often made in an urgent care or hospital setting. Okay. Blood glucose test. A high blood sugar reading in a person with classic symptoms is the first indicator. A random plasma glucose of 200 mg per dl or higher is a strong sign. What are the confirmation tests? To confirm it's type 1 diabetes, not type 2, doctors will run specific tests like autoantibody panel. This blood test looks for the presence of the specific antibodies like GAD65 or isolate cells of antibodies. Okay, these are the two major antibodies. Presence of these confirms that there is type 1 diabetes. These attacks the pancreas. Their presence is definitive sign of the autoimmune process. Okay. Next is C-peptide test. When the pancreas produces insulin, it releases a fragment called C-peptide. Okay, C-peptide. A very low level of C-peptide in the blood confirms that pancreas is not producing its own insulin. Okay, presence of very low level of C-peptide confirms that there is no production of insulin or there is very minimal production of insulin. Okay, other diagnosed monitor is a lifelong 24/7 commitment. This involves self-monitoring of blood glucose using a glucometer to check blood sugar levels with a finger prick test multiple times a day. Do not use multiple times a day because healing process takes longer time in diabetic patients. So I will suggest 15 days checking of your blood sugar is enough, more than enough. Okay, what is continuous glucose monitoring? This technology is a game changer. A small sensor is inserted just under the skin, means patches. These are novel drug delivery approaches which are not used that much level because education and literacy rate in India is very poor. Okay, so we will not move into that segment, rather we will stick with this information of ours. So it is a game changer. A small sensor is inserted just under the skin which measures glucose in the interstitial fluid every few minutes and sends the reading to a smartphone or a dedicated receiver. This provides a dynamic real-time picture of glucose trends. Okay, beside all this, now we will talk about pharmacological management, the most important thing to know about the diabetes or the disease. Okay, or any disease. So most important difference between type 1 and type 2 is the treatment for type 1 diabetes is insulin replacement therapy, means direct insulin is given. You have to take insulin. It is not optional, it is essential for survival. Again I am reading, it is not optional, it is essential for survival. The goal is to mimic the way a healthy pancreas works by providing two types of insulin. Okay, first is basal, which is background insulin. A healthy pancreas release a small steady trickle of insulin 24 hours to manage blood glucose between meals and overnight. We replicate this with a long acting insulin like glargine or degludec. Okay, taken once or twice a day can manage the level of insulin in your body. Next is bolus dose, a direct dose, a total means a only single dose, bolus dose. Okay, meal time. The pancreas releases a burst of insulin in release to the carbohydrates in a meal. We replicate this with a rapid acting insulin like Aspart or Lispro, taken before every meal or snack containing carbohydrates. Okay, this dose is also used to correct any high blood sugar readings. This strategy is known as basal bolus regimen. Okay, insulin delivery methods. What are the methods? How you can take? Multiple daily injection. This involves taking 1 to 2 sorts of basal insulin and multiple sorts of bolus insulin throughout the day using insulin pens or syringes. Means if you have high blood sugar, means you are prone to type 1 diabetes, and after every meal your blood glucose spikes up like hell, then you are needed to take 1 to 2 shots every time. Then our insulin pumps are there, a small wearable device that holds a reservoir of rapid acting insulin. It is connected to the body by a thin tube and delivers continuous slow infusion of insulin to act as the basal rate for meals. The user programs the pump to deliver a bolus dose. Okay, I will suggest the novel drug deliveries have some disadvantages because storing insulin is the major concern. If you are wearing or you are using the patch, then how you are maintaining the storage levels, means how you are maintaining the temperature, because body temperature is approximately 30 degree and insulin requires approximately 25 degree Celsius. So it is also a major concern. Okay, now we will move to advanced hybrid closed loop system, often called an artificial pancreas. Okay, either we can use insulin every time or you can use a artificial pancreas, but it's much more costlier and not affordable for the BPL group of India people, BPL group peoples of India. Okay, these advanced systems link an insulin pump with a CGM. Okay, an algorithm on the device automatically adjusts the basal insulin delivery based on the real-time CGM readings and significantly reducing the burden of the management. Done. Means here pharmacological treatment is simply you have to take the insulin, either you have to take multiple dose or you have to take bolus dose, or you can use artificial pancreas technique. Okay, now we'll talk about the non-pharmacological parameters. Living with type 1 diabetes requires a careful balance of insulin with diet and activity. Carbohydrates counting. This is the most crucial nutritional skill for managing type 1 diabetes. Since bolus insulin is dosed to cover the carbs you eat, learning the accurately count of the grams of carbohydrates in your food is essential for keeping blood sugar stable. Means you have to count the carbohydrate intake. Okay, you must not use as much as you want. Next is exercise. Physical activity is very important for overall health, but it can cause blood sugar to drop. People with type 1 diabetes must plan carefully, often checking their blood sugar before, during and after exercise and potentially adjusting their insulin doses or eating a snack to prevent hypoglycemia. Okay, to lower blood sugar. Mental health. Managing mental health is a prime concern in every disease. If you are mentally healthy, then you can manage or prevent any disease. Means you must have a strong mindset to prevent or to control any disease. Having a strong support system, connecting with other people with type 1 diabetes and seeking professional psychological support are vital parts of a comprehensive care plan. Now we will talk about the traditional approaches. In type 1 diabetes, there are no direct approaches which you can use. There aren't anything, so we won't go to that section of our topic. Rather, we will focus on these. If you have any doubt or anything, let me know.